All right, welcome everyone. It's a pleasure to see all you back on our Olive Online, yet another very informative session with a special guest speaker. Thanks to our friends from Sahara Cares and Bilal for arranging this connection with the Center of Healthcare Rights. We have our speaker, Catherine Nicklen. Allow me to introduce Catherine to you all. She is the Community Education Coordinator at the Center of Healthcare Rights, also known as HICAP for LA County. She coordinates community education programs for Medicare beneficiaries and the healthcare and social work professionals who serve them. Catherine is also a state registered HICAP counselor and helps answer questions about Medicare over the phone. She has been at the Center for Healthcare Rights since 2014. But is always learning something new about Medicare and never ceases to be amazed by the complexity of the healthcare system. I agree with you on Catherine. I've attended so many of these workshops. I still find it mind-boggling about all the different types of Medicare, the different parts. So I'm excited for this session, and it looks like it's open enrollment time. So great time for us to learn. So take it away, Catherine.
Thank you so much, and thank you to everyone who is attending. I do have a PowerPoint to share with you. We're going to talk about what Medicare open enrollment is, what some of the coverage options are, and some assistance programs that can help you lower your Medicare costs, especially for Medicare Part D, which is the prescription drug coverage. So just give me one moment while I share my screen, and then we'll go ahead and get started. Okay, so hopefully everyone can see that. Before I get started, I want to give you a little bit of information about the organization that I work for. It's called Center for Healthcare Rights, and we are a nonprofit organization. We provide free help with Medicare. So if you ever have any questions about how Medicare works, or what your options are for coverage, or whether you're eligible for any assistance programs, please feel free to give us a call. Again, the services are free. And the nice thing about our organization is that we do not endorse or recommend or promote or sell any insurance. Okay, so when you call us, we are here to answer your questions. We're here to help you understand how your Medicare works. We don't want to pressure you into buying a plan or changing your plan if you don't want to, right? Most of our funding comes from the California Department of Aging. They have a grant called Health Insurance Counseling and Advocacy Program, and the abbreviation for that is HICAP. And so the reason that's important to know is because sometimes you will be told, oh, you have a question about Medicare? Call your local HICAP office. So if you live in LA County, we are your HICAP office, and we are also part of a national network of organizations that provide help with Medicare. That national network is called SHIP, State Health Insurance Assistance Program. So I'm sure some of you may have already gotten this book. Let's see if you could see it. Oh, probably not. It's the Medicare and You book. It's kind of blurry, but it comes every year in the mail around this time. And if you look on the back of the book, there's a phone number. It says, call this number for free personalized health insurance counseling. And it says SHIP for California, California Health Insurance Counseling and Advocacy Program. So if you call that number, you will reach us. Okay. So this is our local number. Make sure you save it. It's 1-800-824-0780. You can call us Monday through Friday, 9 a.m. to 5:30 p.m. Again, I'll repeat the number. It's 1-800-824-0780. And you have to schedule an appointment to speak with one of our registered counselors. All of our counselors are very well trained, and they do have to be registered with the state, right? So call us, schedule an appointment, and the appointment is over the phone. We don't go to your house. You don't come to our office. We answer your questions over the phone. So like I said at the beginning, today's presentation is going to talk about, what is Medicare open enrollment? What are your Part D plan options? We're going to talk a little bit about other enrollment periods. We're going to talk about the costs for next year for prescription drugs. And then we're going to talk a little bit about some assistance programs that can lower the cost of your prescriptions. So Medicare open enrollment is every year from October 15th through December 7th. So it's about to start in about a week. And during the open enrollment period, you can change your Medicare Part D drug plan. If you make a change during open enrollment, your new plan will start January 1st. So Medicare open enrollment is a very big deal because for most people, it is the one time of year that they can make a change to their Medicare plan. So during this time, you will see a lot of advertisements. You may get phone calls. You may get advertisements in the mail. You'll see them on TV. You have to be very careful during this time because there is a lot of publicity and advertisement from all the different plans. So again, take this opportunity to shop around, review your Medicare drug coverage, and make a decision about whether you want to stay with your current plan or whether you want to switch to a new plan. So just as a little bit of background, let me start with some very basic information about what is Medicare, right? So Medicare is a federal health insurance program for people who are age 65 and older, and some people who are permanently disabled who are younger than 65, right? But Medicare has three different parts. There's Part A, hospital insurance, and Part B, like boy, medical insurance, okay? So if you are already on Medicare, you probably have this Medicare health insurance card. It's a red, white, and blue card, and it'll say your name, it'll say your Medicare number, and it'll say when your Part A and B started, okay? But once you have Medicare A and B, you also need to make a decision about the third part of Medicare, which is Part D, like David, prescription drug coverage. This is something separate that you need to decide on. And there are two options for Part D. You can either enroll in a prescription drug plan, or you can enroll in a Medicare Advantage plan. These two options are very, very different. So let's look a little bit more closely at the first option. The first option is if you want to stay on original Medicare, you have to pick a prescription drug plan. Original Medicare allows you to see any doctor, any specialist, any hospital that contracts with Medicare. You don't need to wait for any referrals or prior authorizations. And so if you want to stay on original Medicare, some people also call it straight Medicare, you have to pick a prescription drug plan. And the prescription drug plan, you're only going to use it for Part D, your prescription drug coverage. So you're only going to use it when it's time to pick up medication at the pharmacy, right? And so if you stay on original Medicare and you enroll in a drug plan, a prescription drug plan, you have to think about how to supplement Medicare, because original Medicare can be very expensive. You may have heard that Medicare only covers 80% of the costs, right? That's a very simplistic way to put it, but it's a good way to think about it, right? If you stay on original Medicare, you have to worry about the other 20% of the costs of your services, right? So original Medicare is a good option for people who want to pick their own doctors, who don't want to have to be in a plan where the plan has to authorize their care or approve referrals to see specialists, but it can be the more expensive option. And you have to think about how to supplement original Medicare. So that's option number one. Option number two is to enroll in a Medicare Advantage plan. The Medicare Advantage plans don't just cover Part D, they also cover Part A and Part B as well. So these plans in LA County are primarily HMO plans. Medicare Advantage is also known as Part C, like Charlie. So let's look at the Medicare Advantage plans a little bit more closely. The Medicare Advantage plans, like I said, here in LA County, they are primarily HMO plans. So when you enroll in a Medicare Advantage plan, you are assigning all your Medicare benefits to that plan, right? And each plan has its own network of doctors and specialists and hospitals. You have to work with your primary care doctor to get referrals to see specialists. And your plan has to authorize your specialty services, right? If you need a specific treatment or a specific piece of equipment, your Medicare Advantage plan has to approve it first before you can get that service or treatment. So if you enroll in a Medicare Advantage plan, you have to stay in their network. You can only go outside of the network when you need emergency services or if you need urgent care. Okay, but for all your other routine care, you know, your regular doctor's visits, your regular specialist visits, you need to stay in the network of the plan. So it's a very big decision that you have to make if you're on Medicare, right? Only you can decide what is best. Either original Medicare with a separate drug plan, or you can decide if a Medicare Advantage plan is the better route, okay? So again, during this open enrollment season, there is a lot of advertising, a lot of information from all types of different plans and companies, and it can be a little difficult to navigate those options. So if you ever have any questions, feel free to give us a call and we can kind of, help you determine what might be best. If you want to stay on original Medicare, like I said, you do need a prescription drug plan. So how do you shop around for a prescription drug plan? Well, you have to make sure you're looking at prescription drug plans that cover all of your medications, right? Different plans have different formularies. The formulary is the list of the drugs that are covered by the plan. So not all plans cover all prescriptions. So sometimes I've talked to people who say, oh yeah, I'm just gonna pick this plan because my wife already has that plan and she likes it, so I'm just gonna pick that plan too. But that might not be a good idea, because if you take prescriptions, you wanna make sure that you pick your own plan that you know is gonna cover your prescriptions at the lowest price, okay? And you have to look at not just, does the plan cover the prescriptions, but what is the monthly premium? In other words, what's the monthly fee for being in the plan? Does the plan have a deductible? And then what are the co-pays for the different medications? Just remember, a deductible, if you join a plan that has a deductible, it basically means that you have to pay full price for your prescriptions until you meet your deductible. Once you meet your deductible, once you have paid your deductible, then the plan starts covering a portion of the cost of each medication, and then you pay a copay. Okay. And then you want to make sure that you know whether the drug plan you're considering has any special rules for your medications. Does the plan require a prior authorization? Does the plan have quantity limits? So for example, you need 60 tablets, but the plan only covers 30 tablets a month, right? That's what a quantity limit is. And then what you always want to avoid whenever possible is something called step therapy. You don't want to join a plan that requires step therapy for one of your medications, because what that means is that the plan wants you to first try other cheaper alternatives and show that they don't work before they cover the prescription that your doctor has prescribed. So there's all these little details that you need to look at when you are comparing prescription drug plans. And then one last question that you want to make sure you know the answer to is, does your plan work with your specific pharmacy, right? If you use a big national chain like CVS or Rite Aid or Walgreens, usually you won't have too much trouble finding a plan that contracts with those pharmacies. But if you use a smaller community pharmacy, like maybe a pharmacy that's family owned or that's been in the community for a long time, and you want to make sure you keep using that pharmacy, then yes, double check that the plan you're considering has a contract with that pharmacy, right? And some pharmacies are preferred pharmacies, which means they can offer lower costs. So that's another thing to look at. So that's original Medicare with a prescription drug plan, right? Now, if you're considering the second option, which is the Medicare Advantage plan, which includes Part A, Part B, and Part D all in one, then there's other questions you have to ask yourself when you are shopping around or comparing the Medicare Advantage plan. So let's look at that next. These Medicare Advantage plans, like I said, in LA County, they are mostly HMO plans, right? So these plans offer extra benefits that original Medicare doesn't. So some of the extra benefits include maybe some dental coverage, maybe some transportation services, gym memberships, vision coverage, so eyeglasses. Sometimes they'll cover hearing aids, right? And these plans also generally offer lower costs compared to original Medicare. So those are some of the positive things about joining a Medicare Advantage plan, right? That they tend to be cheaper than original Medicare, and they sometimes offer extra benefits that original Medicare doesn't cover. But because these plans have a specific network that you have to stay in, you want to make sure you are only looking at plans that have a contract with the doctors and hospitals you want to use, right? Because you're going to have to stay in their network. A lot of these plans, like I said, are cheaper than original Medicare, but that doesn't mean that they don't have costs, right? There's still going to be copays. So you want to make sure to compare what different plans are going to charge you for a doctor's visit, for a specialist office visit. You know, how much does it cost if you have to go to the emergency room? How much does it cost if you need to go to urgent care, right? So you want to compare not just the network, but also the costs offered by the plan. And then don't forget, these plans also include the drug coverage. So you still want to make sure your drugs are covered at the lowest cost possible. Now, you heard me say at the beginning that open enrollment is about to start, right? We have open enrollment from October 15th through December 7th. But if any of you are going to be new to Medicare soon, or if you know someone who is going to be new to Medicare soon, maybe they're going to be turning 65 next year, let them know that they have their initial enrollment period, which is, it starts 3 months before their 65th birthday. It includes the month of their 65th birthday, and then it goes for another 3 months after their 65th birthday. So it's a total of 7 months, right? So we want to make sure people don't miss their initial enrollment period. Now, right now in the fall, we have open enrollment for Part D, right? So this is the time to check your Part D coverage. And then at the beginning of the year, we have the Medicare Advantage open enrollment period, which is from January 1st to March 31st. And that is only for people who are in a Medicare Advantage plan at the beginning of the year. So let's say that someone joins a Medicare Advantage plan and they decide at the beginning of the year that maybe they made a wrong choice. Maybe they don't like the plan that they selected. They can use the Medicare Advantage open enrollment period to switch to another Medicare Advantage plan or to switch to original Medicare with a drug plan. There are also special enrollment periods. So sometimes if you have a special circumstance, that could trigger or cause a special enrollment period, basically an opportunity for you to change your Medicare drug coverage, even if it's not open enrollment. So for example, if you move to a new area, let's say you've been living in Los Angeles and then you move to Texas, or you move to New York or to Florida, or you move to San Francisco up in the Bay Area, that will trigger a special enrollment opportunity for you to say, you know what, I am moving to a new area. My plan doesn't work in that area. I'm going to take this opportunity to find a new Medicare plan. And then if any of you are low income and qualify for the extra help low income subsidy, which lowers Part D drug costs, you have a special enrollment period throughout the year to make changes to your Medicare coverage. And so you can make a change once per quarter during the first 9 months of the year. So what does that mean? It means that from January to March, you can make one change. From April through June, you can make one change. From July to September, you can make another change. Obviously, it's not a good idea to be constantly changing your plan, because that can cause a lot of chaos and confusion. But it's good to know that you do have that flexibility to make a change if you need to. Now, some people ask us, you know, I don't take any prescriptions. Do I need to enroll in Part D? And the answer is, you know, no, you don't have to enroll in Medicare Part D drug coverage, right? Because the enrollment is considered voluntary. It's up to you to take that extra step and either enroll in a prescription drug plan or a Medicare Advantage plan that includes drug coverage. So you don't have to enroll in Part D, but you may have to pay a late enrollment penalty if you don't enroll in Part D when you were first eligible to do so. So when people ask us, hey, I don't take any medications, I don't want to enroll in Part D, do I have to enroll in Part D? We tell them, you probably should enroll in Part D because we don't want you to have a late enrollment penalty in the future, okay? Some people don't have to enroll in Medicare Part D drug coverage if they already have good drug coverage through another source. So for example, if you have an employer plan, like let's say you're still working, or your wife or your husband is still working and they are covering you under a plan that has good drug coverage, you may not need to enroll in Medicare drug coverage, right? And the same is true for anyone who is a veteran who has VA benefits or something called TRICARE for Life. They don't have to enroll in Medicare Part D, okay? But again, for everyone else, there is a late enrollment penalty if you don't enroll in Medicare Part D when you are first eligible to do so. So the other question that we get a lot during open enrollment is, you know, I'm happy with my plan. You know, do I need to make a change to my Medicare Part D drug coverage? And the answer is no. You know, you don't have to make any changes. If anyone is pressuring you to make a change or to enroll in a different plan, you know, give us a call, because that could be fraud. It could be marketing fraud if someone is pressuring you into changing your plan. Again, you don't have to change your plan in most circumstances. Sometimes you may have to change your plan if your current plan is no longer offered for next year, then you may have to make a change, right? But in most cases, if you're happy with your current coverage, you don't have to make a change. But that doesn't mean that you shouldn't take this opportunity to shop around to see if there's a better plan for you, because plans do change from year to year. Sometimes plans stop covering certain medications. Other times plans change the cost of the medications. You know, maybe they change the copay or the premium. So it's always a good idea to just double check and make sure you're in a good plan for next year. You want to make sure you're in a plan that covers all your prescriptions at the lowest cost possible, right? Especially if you're trying to save money. Usually, when people are interested in shopping around for a new drug plan, we look at the Medicare website. The Medicare website looks like this. Okay, it's medicare.gov.gov. Make sure you don't go to some other site like medicare.com or, you know, some other private website. You want to make sure you use the official government website, which is medicare.gov, which stands for government. And on that website, you can do a search. You can put in the list of your medications, your zip code, and the name of your pharmacy, and then it'll give you information about which plans cover those prescriptions at the lowest prices. If you need help with that, you can give us a call and we will help you with the search. Now, the costs that you pay for prescriptions can really vary. It can really depend on which prescriptions you're taking, right? If you're someone who only takes very common generic medication, maybe for high blood pressure or cholesterol, then, you know, your costs may be relatively low. But if you're someone who takes a lot of medication, a lot of expensive medication for maybe some very serious chronic conditions, right, then your costs might be a lot higher than most people. So again, costs can really vary from person to person, depending on which prescriptions they take. The costs also can vary depending on which plan you end up selecting. Some plans are cheaper than others, right? And then lastly, you may pay much lower costs than other people if you qualify for a low-income assistance program. And costs can really vary. For next year, the drug plan premiums can be anywhere from $0 to $160 a month, right? So the most expensive plan available in California is $160 a month. Obviously, you don't want to join such an expensive plan if you don't have to, right? And then the deductible, meaning the amount you have to pay before your drug plan starts to pay for your prescriptions, that can really vary. There are some plans that have a $0 deductible, and there are some plans that have a deductible as high as $480. Now, when you take prescriptions and you have Medicare Part D, there are different coverage periods that can affect how much you pay for your prescriptions throughout the year. So in the initial coverage period, you typically pay 25% of the total retail cost of your prescriptions. Then, if your total drug costs reach over $4,400, you may enter the coverage gap, at which point you still keep paying 25% of the total retail costs of the prescriptions. And then if you end up having over $10,600 in total drug costs, you may enter the last phase, which is the catastrophic coverage phase. And if you get there to the catastrophic coverage phase, your co-pays go down dramatically. You were paying 25% of the total retail costs, but in the catastrophic coverage phase, you go down to about 5% of the total cost. So again, these costs really vary depending on the prescriptions you take, what plan you choose, whether you qualify for any low-income help or not. Now, a lot of the people that we help in our office have both Medicare and they qualify for Medi-Cal as well. Remember, Medi-Cal is a program for people who have very low income and very low resources. So if you have both Medicare and Medi-Cal, you actually qualify for extra help or low income subsidy, which lowers the cost of your prescription drugs very significantly. So for this year, the co-pays for people who are Medi-Medi, who have Medicare and Medi-Cal, were $1.30 for generic medications and $4 for brand name medications. Now for next year, it looks like the cost is going to go up a little bit. So if you have Medicare and Medi-Cal, next year, your generic prescriptions shouldn't cost more than $1.35, and the brand names should still be no more than $4. Now, even if you don't qualify for Medi-Cal, you might still qualify for the low-income subsidy or extra help program, which is a program that you can apply for through Social Security. We can help you with the application as well if you call our office. And this is a program that reduces the prescription drug copays. So depending on what your income and resources are, remember, resources are things like savings in the bank or retirement accounts, right? Depending on where your income and resources are, you may qualify for either full extra help or partial extra help, right? Full extra help provides more assistance. Partial extra help provides a lower level of assistance. But these are the income and asset or resource limits on the screen. Again, you can see that the income limit is quite low, but the resource limit is much higher than it is for Medi-Cal. So let's say your income is very low, but let's say you have some money saved in the bank. Let's say you are a married couple and, you know, through all your hard work, you've managed to save up $25,000 for an emergency, right? You may not qualify for Medi-Cal because you have those savings, but we can look to see if you could qualify for this extra help program so that you can at least get some help with the cost of your prescriptions. So the point I'm trying to make is, if you have Medicare and Medi-Cal already, you already qualify for help with the cost of your prescriptions. But even if you don't qualify for Medi-Cal, give us a call, because we could see if you might qualify for the extra help low income subsidy program through the Social Security office. Now, for anyone who does qualify for that extra help program, for the full extra help assistance with the prescription drugs, there are 5 drug plans next year that you may want to consider joining, because these 5 drug plans have no monthly premium, meaning you still have to pay the copay for your prescriptions, but at least you don't have to pay a monthly membership fee for these plans. Okay, so again, these are the 5 plans next year that do not charge a monthly premium if you qualify for the extra help with the prescriptions. If you ever join a plan that does not cover one of your prescriptions, you have a few options, okay? If you are new to the plan, let's say you just joined the plan and you are within the first 90 days of being with that new plan, and you are trying to get a prescription that you've already been taking for a long time. You've already been prescribed that medication before. It's not a new medication. You can ask your new plan for what's called a transition fill, meaning that they will cover a 30-day supply of your medication to help you transition into the plan. So you're saying, hey, I know you don't cover this prescription that I'm taking, but I am new to your plan. Can you please give me a one-time refill for 30 days of the prescription to help me basically get through the month, help me transition into your plan? After that, you want to make sure to ask for an exception request. Or if you're not eligible for a transition fill, you can ask the plan for an exception request. This is where you may ask your doctor for help. The doctor would have to submit some information to your prescription drug plan saying, hey, we understand that this prescription is not covered by the plan, but this patient needs this medication because of this medical reason, right? Sometimes people join a plan and the plan only covers the generic version, not the brand name version, right? And sometimes we have people who say, no, I don't want to take the generic. I want the brand name medication, right? But the plan says, no, we don't cover the brand name. We cover the generic version because it's cheaper, right? It's more affordable and it's just as effective. So in that case, you could ask for an exception. You can tell the plan, hey, I know you only cover the generic, but I want the brand name. Can you make an exception for me? Can you cover the brand name? Obviously, you need to have a good, valid medical reason. Perhaps you already tried the generic and it gave you an allergy or it didn't work, right? But you can't just say, no, I want the brand name because brand name is better, right? That's not a valid reason. So anyway, you have these different options. If you find yourself in a situation where you're in a plan and the plan doesn't cover your prescription, you can either ask for a transition fill or you can ask for an exception. And in the worst case scenario, you can also change your plan to a plan that does cover all your medications. If you are low income and you qualify for Medi-Cal help, or you qualify for the extra help low income subsidy, and you find yourself in a position where you don't have a drug plan for some reason, there is a temporary program called Limited Income Net that can provide drug coverage for you on a temporary basis until you enroll in a Medicare drug plan. So there is this temporary drug coverage. You know, don't pay full price for your prescriptions at the pharmacy. If they tell you, oh, you don't have a drug plan, you know, give us a call. We can help you enroll in this temporary program. And if you have any questions about it, again, you can always give us a call. Now, where should you be getting your information about Medicare drug plans? Well, the Medicare website, which is medicare.gov, that's the official government website for Medicare. That website has very good information about Medicare. And like I said, you can put in your zip code and get some information about which plans are in your area. You can also call the Medicare telephone hotline, which is 1-800-633-4227. That's basically like a call center where representatives can help answer some general questions about Medicare. You can also call your drug plan directly, right? If you're already in a plan, call the number on your card and say, hey, I have some questions about what the plan is going to be like for next year. You know, is this prescription going to be covered? Is this pharmacy still going to be in network? So the drug plans are a good source of information. And then don't forget that you have us as well, Center for Healthcare Rights. We're here to help answer your questions. And again, I mentioned this briefly at the beginning, but you want to make sure to be very careful about your Medicare information during this open enrollment season, because unfortunately, there are a lot of scams and fraud that target people with Medicare, right? One of the things you do need to be careful about is the insurance agents pressuring you to switch your plan or to change your plan, right? And, you know, just know that there are some very strict rules that the insurance companies and the insurance agents have to follow. They're not supposed to be cold calling you at home, bugging you to change your plan. They're not supposed to approach you in public common areas. For example, if you live in a senior building, they're not supposed to be going door to door, knocking on your door, trying to sell you a plan, right? And be very, very careful of anyone who calls you and says that they're calling from Medicare. Medicare does not call people, okay? Medicare will never call you. And of course, be very careful, protect your information, protect your Medicare number, protect your Social Security number, protect your name, date of birth, and address, okay? We are working with another organization called Senior Medicare Patrol to educate people about fraud and scams. So if you think you may have been a victim, or maybe you've been misled into joining a plan that is not appropriate for you, you can call our office for help, or you can also call the Senior Medicare Patrol. Their phone number is 855-613-7080. So I hope this presentation has given you a good overview of what Medicare open enrollment is and the types of things you should be thinking about during this time. You know, do you want original Medicare with a drug plan, or do you want a Medicare Advantage plan? You know, are you in a plan that covers all of your prescriptions at the lowest price possible, etc. So I'll leave it at that for now, and we can go ahead and open it up for questions. Thank you, everybody. So I think you may all be muted, so feel free to unmute yourself and let me know if you have any questions, or you can type them into the chat box too.
Hi, Catherine. My name is Anu. I apologize. I'm having some internet issues and wasn't able to hear the very beginning of your presentation, but I wanted to thank you so much because you just shared a wealth of information, and it just goes to show that that we must be very careful about disclosing our information, especially the tail end of what you talked about in terms of protecting our privacy.
Yes, definitely. Unfortunately, the Medicare beneficiaries, you know, people with Medicare, and especially those who have both Medicare and Medi-Cal, they are highly targeted for scams and fraud. So yes, we all have to be very careful. And I think we do have a separate presentation that's all about Medicare fraud. But yeah, it's a big concern. We're seeing a lot more of it. There was a time where we were getting a lot of calls from people saying, hey, an insurance agent called me. They told me that, you know, I would get more benefits if I joined this plan. So I changed, and now my doctor won't see me because my doctor doesn't accept that plan. So again, just to be clear, there's nothing wrong with changing your plan. There's nothing wrong with joining a Medicare Advantage plan. Sometimes those plans can be very good. Sometimes they do offer some really good extra benefits that Medicare doesn't cover, right? But I think there's a difference when, you know, you change your plan under some, you know, misinformation that you were given, right? And then you can't access your doctors or the services that you were getting before. So yeah, thank you for your comment.
Hi, Catherine. My name is Najma. Hi, Catherine. My name is Najma. Your presentation was very, very informative, and I really appreciate your info. But I have a question regarding, I have Medicare, and I have supplemental plan also, which is very expensive, and it's plan A. Do you have any other suggestion to reduce that plan expense? I have to pay every month $210.
Yes, that's a very good question. So remember how at the beginning we talked about how there's two options, right? There's original Medicare with a drug plan, right? And then
Right.
there's Medicare Advantage plans, which are the more affordable option because they include Part A, B, and D, and they have lower copays compared to original Medicare. So one option you have is, rather than staying on original Medicare with the drug plan and your private supplement, you can switch to Medicare Advantage, but that would mean that you would be restricted to the network of that particular Medicare Advantage plan. So you may not want to do that, right? You may want to stay as you are with original Medicare so that you can keep selecting your own doctors. You could go to whatever specialist you want. You could go to whatever hospital you want. You don't have to wait for referrals or authorizations, right? So you may want to just stay with that, but just know that there is that option of Medicare Advantage if it ever becomes just too expensive to keep paying for your Part B premium, your Part D premium, and then your Medicare supplement plan premium. Now, the other option is you can look at switching to a more affordable Medicare supplement plan, right? In the state of California, there's a birthday rule for the supplement plans that says for 30 days following your specific birthday, you can switch your supplement to the same level of coverage, but with a different company that perhaps offers you a lower rate, or you can switch down to lower levels of supplemental coverage, assuming that it's for a lower rate as well. So that's just a little bit of information. I would say if you're really seriously considering possibly switching to something more affordable, you may want to call us so we could talk, in private about your situation.
The only AARP, I'm the member for the AARP because it is affiliated with United, which is affiliated with Medicare. And I don't have to pay anything.
There's a lot of other companies that sell the supplement plans though. So it may be helpful to look at other companies' rates for that supplement, right?
But it has to be affiliated, right, with the Medicare?
Any plan that is a Medicare supplement is going to be affiliated with Medicare.
Okay.
Yeah.
Okay.
So don't think that, AARP or United Healthcare is like the only option. They use their AARP and United Healthcare will sometimes say, oh, we're, they have that big name recognition, so sometimes they use that to their advantage, but there's a lot of other companies that also sell the supplement.
But does it depend on the doctor? Will they?
No, because if you're on original Medicare, you can go to any doctor that contracts with Medicare.
No, for the
Remember,
supplemental.
The supplement is not the same as a Medicare Advantage plan. In a Medicare Advantage plan, it does matter what your doctors contract with, right? But when you're on original Medicare and you have a private supplement, you can go anywhere.
Okay. Thank you so much for your help. And if I have any questions, I can call them to get the supplement plan info.
Yes, you can. You should probably call us so we can walk you through more details.
Okay. Thank you very much, Catherine.
Yeah, you're welcome.
Can we call you even if we live in Orange County?
That's a really good question. Yes, I forgot that some of you are in Orange County, so you will have to contact your local high cap. I don't know if you were at the beginning of the presentation. Yeah, so Center for Healthcare Rights is the high cap for LA County. And then your high cap, I think, is called Council on Aging, if I remember correctly. I can give you the number.
Okay, great.
Let me just look it up real quick. But yes, each county in California has their own office that, okay, yes. So for Orange County high cap, it's called Council on Aging. And I'll put the phone number in the chat, and I will also say it out loud if anybody wants to write it down. So the phone number is 714-560-0424.
And Catherine, can you include the one for Riverside County as well, please?
Oh, yes, definitely. For Riverside, so for Riverside County, the phone number is, excuse me. So for Riverside County, the phone number is 909-256-8369.
Thank you.
And
So
Is it the same name too?
it's not looking like it's the same name. This one is just listed as Riverside County High Cap Office.
So Catherine, for Orange County, I live in Irvine. So if I have to call, the number you gave, 714-560-0424 is the one?
Yes, that's for Orange County.
Any
High Cap.
questions, right? Any questions regarding?
Yeah, all the offices work a little bit differently, but we're all registered and trained to answer, you know, those types of all the same Medicare questions. Yeah.
Okay, thank you.
Anybody
Catherine,
else?
yes, Catherine, I have a question. Do you need to have a supplement insurance if you have Medicare?
Well, again, let's look at that. Let me pull up the PowerPoint real quick again, just so that everyone can see what I'm talking about. Okay, so remember, if you have Medicare, you have the two options, right? Which are original Medicare with a drug plan, or Medicare Advantage, which includes everything all in one plan. If you join a Medicare Advantage plan, you don't need anything else, right? Because your Medicare Advantage plan already includes your Part A, your Part B, and your Part D. And the costs are lower, right? You pay whatever your Medicare Advantage plan says you pay, right? So some of them say, you know, a doctor's visit is $0, a specialist visit is $10, right? So in a Medicare Advantage plan, that's all you need. You don't need anything else. But if you want original Medicare, which allows you that flexibility to pick your own providers because you can go anywhere that contracts with Medicare, then you need your separate drug plan. And then, yes, you do need to think about how to supplement Medicare, because original Medicare, the costs are so high, right? You may have heard, I said this earlier, but you may have heard, for example, when people say, oh, Medicare only covers 80%, right? And again, that's a very simplistic way to put it, but it's a good way to think about it. And it's true. If you are on original Medicare and you don't have any other kind of additional supplemental coverage, you could be faced with very high bills depending on what services you end up getting. If you end up being admitted to the hospital or the nursing home, or if you are on dialysis, or you take really, you know, you have a lot of labs or MRIs that you always have to do, right? So if you want original Medicare, then yes, you should really think about, okay, what kind of supplemental coverage am I going to add to Medicare? And so that's where the private Medicare supplements come in. But those companies are, those plans can be expensive, right? You may have heard the other person's question about how she's paying, you know, over $200 for her supplement, and she wants to know if there's possibly something
Less
a
expensive.
little cheaper, right? So supplements can be expensive. And again, it's up to you to decide what you think is better. You know, do you have the money and the desire to pay so much for your healthcare insurance? And then don't forget that in all of this, we also have to think about Medi-Cal, right? I mentioned a little bit about Medi-Cal, but if you are a low income person, you know, if your income is very low, you have low resources or assets, you may qualify for Medi-Cal. And Medi-Cal acts as a secondary to Medicare, where you can be on Medicare, you could pick whatever Medicare coverage you want, and you don't have to worry about the cost because Medi-Cal helps to cover your Medicare expenses.
Thank you.
Great,
Thank you.
Thank you so
I
very
have
much.
another question.
Okay.
Hi, Catherine. I have another question. What if you go into a nursing home and say it's like end of life? Does Medi pick up all that, or would that just be like on the family or on your savings, or what would that be?
Yeah, so I mean that's a good question. I mean, these are all really good questions. They're not necessarily, you know, relating to the topic of today, but you know, it's a good question nonetheless. So I can take it. But when you are on Medicare, right? Medicare only covers a limited amount of nursing home coverage, right? And only under very specific circumstances. So when you're on Medicare, if you need to go into a skilled nursing facility, in order for Medicare to pay for your stay in the skilled nursing facility, you have to have had a 3-day prior hospital stay where you were admitted into the hospital as an inpatient and you stayed there for at least 3 days. And then they discharge you to the nursing home because you need skilled nursing services or therapy. Maybe you broke your hip and you need physical therapy to get walking again, or you know, some other kind of occupational or speech therapy. Like let's say you had a stroke, right? And then you were admitted into the hospital. You were in the hospital for at least 3 days, and then they discharge you to the facility for some skilled nursing services, some rehabilitation services to help you get past that initial, you know, those initial issues dealing with the stroke, right? So in those circumstances, Medicare will pay for a skilled nursing facility, and they will pay up to 100 days per benefit period. What that means is a benefit period is when you have you've been admitted into the hospital and you've gone to the nursing home, right? And let's say you have been discharged and you've gone home for 60 consecutive days, meaning for 2 straight months, you didn't go back to the hospital or the nursing home. Let's say you have to be readmitted to the hospital or the nursing home, then you start a new benefit period. You start back at day 1. So that's a little complicated, but basically it's 100 days in a nursing facility per benefit period. Now,
what about after
if you
that?
need care after that, or if you need care that isn't considered skilled nursing care or skilled, you know, therapy and rehabilitation services, then Medicare will not pay for that, right? So that's where either private pay, meaning you, the family, has to pay privately for the long-term care facility or the stay in the nursing home, right? And that can be very, very expensive. Or maybe someone has a private long-term care insurance policy that can help them pay for the stay in the home, the nursing home. Or at that point, depending on the person's financial situation, we could look at long-term care Medi-Cal, which is different from the regular Medi-Cal programs for people, you know, who are just still in their home, right? So there's the option of long-term care Medi-Cal.
And would I have to call Medi-Cal for that?
Well, it depends on where you're at, right? It depends on the situation.
Well, if I needed long-term care, because I want to get the insurance if, you know, like that's why I'm asking
You can only have the long-term care Medi-Cal once you're there in need of those services. You can't apply for it, you know, preemptively.
Okay, what about the private policy? Can you apply for that?
The private long-term care insurance policies are very, very expensive, and they're usually those you can only get when you're younger. Like no one's going to sell you a policy, you know, at this point. Yeah.
Okay.
Because they have like underwriting that they
Yeah,
do.
because I won't pay enough into it to, yeah, I know what you mean. Okay, that's
So
what I
we
wanted to know.
We have another question, I think, Nicole.
I'm gonna have to close the chat pretty soon here because I'm just running late for another meeting. So what I'd like to suggest is that if people have more questions, if they can call, you know, your office.
Yeah, definitely.
To get those questions answered. I'm really sorry, but
that's all right.
We're really over time.
Yeah, that's fine. I have to go too, so thank you.
But I appreciate everyone's you know, interest in it. Is a very important topic, and I'm really glad that you were able to come and share all this wealth of information with our participants, Catherine. And thank you so much again. We really appreciate it.
You're welcome. Bye, everybody. I'm sorry we didn't get to all your questions, but feel free to give us a call if you live in LA. Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you, everybody.
Thank you.
Have a great day.
Have a good day, everybody. Thank you so much.
you.
And I'm sorry again for cutting it short.
Assalamu alaikum.
Welcome.
Alaikum salam. That's good. Yep.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.